Another myth is that acupuncture is evil or utilizes magic. And it is not in any case evil, and it is not voodoo, and it's not Satanism. It doesn't involve any magic. It is a well-studied and well-established form of healthcare. Acupuncture is one of the oldest established forms of healthcare in the world. It's a form of therapy which utilizes very thin needles, usually made of surgical steel, and they are inserted into specific areas around the body to re-establish homeostatic balance, to basically trigger the body's own regulatory functions so that it can trigger healing processes. So I studied acupuncture in the UK. I have a Bachelor of Science with Honours from the University of Westminster, and I also have postgraduate training in acupuncture for infertility and obstetric acupuncture. I've been practicing since 2005. That's about 13 years that I've been doing this, yeah. No, so you needle individually each point. So basically what I would do is I would sit with the patient and I would find out what exactly is going on. If it's a new patient, I would do an in-depth consultation. If it's a patient that I've seen before, I may just touch base quickly on how they've been, what's going on at this particular time, and what we're trying to address. And then I would write a points prescription, and the points prescription would incorporate what I call treating the root as well as treating the manifestation. That simply means treating the symptoms of the problem, but also treating the underlying reasons why they're getting the problem. And then once I've decided, okay, so this is the points prescription, then I will put each point in one by one, not all at once. Often I'll teach them breathing exercises to help them, because breathing triggers parasympathetic nervous response. Simply put, that means the rest and digest function. You get two responses in the body. One is fight or flight, that's the stress response. And one is the rest and digest, which is the relaxation response. Now, breathing triggers the relaxation response. So I will often teach my patients breathing techniques that will help them to relax more deeply. If they're more relaxed, the needles hurt less. And in fact, many patients will not feel the needles or perceive it as a very minor discomfort. Mm-hmm. But I do encourage, especially the more anxious ones, to do some very deep breathing. It depends again on each individual patient and on what I'm trying to achieve. If it's a young child, I might leave the needles in for a very short time. If, it's a patient who is under extreme stress and very agitated, again, I might leave them in for a shorter time. But perhaps I want to work with someone who's fatigued and exhausted or has a chronic condition, I might leave the needles in a little longer. On average, I aim for half an hour with the needles in, because I find that's a good enough time for the patient to be able to relax and for the needles to have some kind of effect. But it will be very personal to each patient. So the top 3 conditions that people come to me for are infertility. Often during pregnancy, I see a lot of pregnant ladies, and pain management is also very common. People come to me for pain management, especially when they haven't had good results just with medication only. So one of the reasons that I think acupuncture is so useful for fertility or fertility-related conditions is that, well, A, there's an evidence base, a clear evidence base from randomly controlled clinical trials to show that it has a very marked effect on fertility. And the other reason is I think that, people who've been going on that journey, trying to conceive and having difficulties. Basically, people who are trying to conceive and then people who have conceived will also come and see me, either for symptoms of pregnancy, so for example, sinusitis, pelvic pain, nausea, various other conditions of pregnancy, but then often as well to help prepare for birth as well. I think it's always lovely. As I mentioned, I do a lot of fertility work, and I think the most exciting and rewarding part of my job is when a patient comes in and says to me, guess what? You know, I'm pregnant, yeah. And that's wonderful, especially when I've been working with patients who have perhaps really been trying for many years unsuccessfully, and who have tried other interventions such as IVF or ART. It's always nice to see, like, that is definitely the best part of my job. Yeah, one myth is that acupuncture hurts a lot, and actually it doesn't hurt very much at all. It does use needles, but these needles are very, very thin, and if you learn the proper technique to needle and the proper places to needle, and you're well versed in anatomy and physiology, you will cause very minimal pain or injury to the patient, and most people find it pretty relaxing, actually. So that's one myth. Another myth is that acupuncture is evil or utilizes magic. And it is not in any case evil, and it is not voodoo, and it's not Satanism. It doesn't involve any magic. It is a well-studied and well-established form of healthcare, with clinical evidence showing the efficacy, and which is endorsed by the World Health Organization as well as a useful intervention for many diseases. It's not magic. It works in a physiological manner. So you're going to feel a sensation like this. You feel that? Mm-hmm. We're going to use the word sharp for that sensation. There's nerve endings in the skin. This is a needle. As it goes through the nerve endings, it will feel slightly sharp, but very little. Yeah? But after it goes through the skin, I want you to feel something else. And that the word we're going to use for that something else is strange. And after it goes in through the skin, it shouldn't feel sharp anymore. I can fix that if it's still feeling sharp. But I do want it to feel strange, because for me that's an indicator that we've got the right acupuncture point, that it's in the right place. So the two words are sharp and strange. Anything that does not feel sharp is strange, even if it's a strong sensation. Yeah? So I'm just going to find it first. Okay, breathe in. What do you feel there? Do you feel anything?
No.
Okay. How about now?
Yeah.
Now you've... Strange. Something different, yes? It's not like that poking feeling. Mm-hmm. It's a different sensation. Mm-hmm. Yeah? Okay.